This episode of The Third Sector is being made possible through the support of Dudas Law, providing skilled and efficient service for a wide range of legal needs. They can help guide you through a system that seems complex and scary. Dudas Law, skilled and compassionate attorneys serving you at 710 East Main in Richmond. And by RMD Patty Insurance, insuring Indiana families, individuals, and businesses since 1927. RMD Patty can help you with everything from life and health insurance to Medicare supplements and corporate wellness plans. If you love it, RMD Patty protects it. Find out more at rmdpatty.com.
Hello and welcome to the third sector. In our society, there are three sectors: the public, the private, and the nonprofit. And it's that third sector that we're here to talk about today. My first guest is Shane Edington with the Whitewater Valley Pro Bono organization. And first, Shane, I never want to assume that people know about the organizations that we're talking with. So would you start by telling us what the mission is for the organization and what it is that you do?
Good morning, Rachel. Thank you so very much for having me. So I'm pleased to be here. Whitewater Valley Pro Bono. What we do is we provide free civil legal services to folks who cannot afford attorneys. Another name might be legal aid. That may be something that folks are more acquainted with. But we do not do anything in the criminal sector. We don't do anything with bankruptcy. We don't do medical malpractice, anything like that. So it's strictly civil work here in East Central Indiana.
Okay. So when you say East Central, do you cover more than Wayne County?
Our primary focus is Wayne County. If something that appears to really warrant our intervention, we have gone out of county in the past, but our primary focus is Wayne County. For a period, we did have funding to assist with mortgage foreclosures in some of the surrounding counties, but that funding unfortunately no longer exists. So our primary focus basically is right here in Wayne County.
Now I want to delve into pro bono. I know that's a term that's used a lot in the legal field, but for those of us that aren't attorneys, what does pro bono mean exactly?
Oh, of course. It comes from the old Latin phrase pro bono publico, meaning for the good of the people. They would be attorneys that do not charge for legal services, or folks that charge a substantially reduced rate for legal services.
So in your case, is there a charge for your services?
No, we do not charge people. What we basically deal with are working families that have children or individuals within the poverty, on the poverty level. Our express fiscal guidelines are 125% to 200% of the federal poverty guidelines. That's kind of the actual numbers that we look at. But we are, I think, more generous as far as when it comes to assisting people.
Yeah. So not just everyone can walk in and get free legal services. There are some qualifications and some guidelines that you go by to provide these services to those that are really in need of legal advice, legal service, and just can't afford it.
Right, and we, like I said just a moment ago, it's a lot of folks with families, with children. A lot of the clients actually have like multiple part-time jobs, but getting a nice full-time job with $20 an hour wages is hard, particularly in this economy. So I have a lot of folks working part-time jobs, or minimum wage full-time jobs, and they have 2 or 3 children at home, and that tends to be a lot of what we have coming in the door.
Before we dig in more into exactly what services you provide and what you can do for the folks in our community, if there's no charge for your services, Shane, how do you do this? How do you fund this office?
Yes, it's a combination of fundraising, events, and grant writing and donations. Um, we receive no money from the state of Indiana. And actually, we really don't receive any funding from Wayne County government. We're located in the Richmond City building because of the generosity of Richmond City government, which is much appreciated. But as far as our funding, we do a golf outing, we do a race, we try to do Paint for Justice. We've done a bowling tournament, and then we do grant writing. And so we're out there with the other organizations attempting to keep our doors open as well. So yes, we don't charge folks for services.
So this isn't funded by our tax dollars. This isn't funded by federal grants. This is you and your assistant. I believe you're the only ones in the office, if I'm correct, really
yes,
working
I'm here
hard.
full time, and I have a part-time secretary. Vicki does a very nice job.
And you're out there raising this money because I know you, Shane, and you have a passion for helping people. And I know how hard you work. So before we get too far, I want to say thank you. Because this is tough work, emotional work. And on top of what you're doing for the folks, you're also raising the money. And so I want to say how much I appreciate that in this community.
Oh, thank you, Rachel. Yeah, it's really odd having to both go to court and also seek out donors for funding. So it's really a very active type of thing that we have to do here to keep the doors open.
Definitely two very different roles. So let's dive in now to the work that you do. On a daily basis, what type of cases do you see? And maybe even back up a step, how do folks come to you? Are they referred? Do they come in the door? What kind of system do you use? Because I know you have to be overwhelmed with people that need your assistance.
Well, we start off with an application process so we can firstly determine whether or not there's any conflict of interest, because I've been practicing for almost 20 years in this county, something like that. So we have to make sure that we don't have a conflict of interest. So we scan for that firstly. And then we start looking at income to make sure, someone's not making $80,000 a year needing us for free type situation. And then we start looking at the facts of the case and whether or not it's something that we handle. And even if it's not something that we handle directly, we can happily refer it out to someone who does do it. So, but the majority of what we do involves families with children. And I think the office kind of reflects what is going on within the broader society. Like 2 or 3 years ago, when the heroin epidemic hit really, really hard, we were really dealing with a lot of custody modifications, guardianship, changes in parenting time, that type of thing. Now that we're seeing more in the way of foreclosures, we're seeing unemployment. Now it seems like we're dealing more with landlords not necessarily doing what they should be doing. And so our office, to a great extent, actually reflects what's going on within the broader community. But yes, it's mostly, well, it's exclusively civil law, but it's mostly family law. So like I said, families with children. I was just looking at what we had from even 2019. We had over 200, we had almost 300 applications come in the door. That's just applications. And it was a combination of divorces, protective orders, custody, support, visitation, did some adoptions, almost 30 guardianships, drafted a few wills, powers of attorney, dealt with landlord disputes, evictions, debts, breach of contracts, name change, and 5 tort cases. So that was just a quick rundown of what we did last year.
How do you do all that, Shane? My gosh, 300 applications, one
Right.
person and a part-time person.
Yes, well, thankfully not everything requires a battle to the death litigation. Sometimes it's just a matter of us sending a letter to someone saying, hey, you need to stop doing this, or you need to correct this problem before we get to that point of needing to litigate. Sometimes it's just advising people as to what their rights are, what they can and what they can't do. And also, I'm pleased that we have a nice section of the bar here in town that helps with cases that I can't take personally because of conflict of interest. Sometimes it's just not a good match, a good match personally, personality-wise, mesh, I guess the word, not a good mesh personally, or they have a skill set that I don't have. So like with probate, I'll ask Bruce Metzger or Ed Martin. Some of the family law cases, Don Simpkin and Amy Noy will take. bankruptcy, I'll send to Craig Parker, who's on our board. So it really kind of depends on what the case is, but I also farm them out to other attorneys if I can't personally do it.
And do these folks also provide these services at no cost then, or do you have to pay sometimes for other legal services?
Oh no, they also do the work for free. So I'm very pleased that we have such strong support among the local bar for the cases that I'm not in a position to take for whatever reason. Actually, we have a dinner every December in which we recognize a member of the bar and frequently a member of the community that has been so helpful with the pro bono organization.
That's exceptional. I am not originally from this community, and I think as an outsider, well, I've been here 26 years, but someone coming into the community, I recognize that we really have such a strong network here of people that are willing to step up and help. Not just folks like you on the front line, but like you said, the other attorneys that are there for you and say, hey, I can take that case. I can do this. And so what a great support system that you have. And I'm thankful it's not just you trying to do 300 cases, Shane. You'd never get any sleep.
Right, exactly. And we also kind of coordinate with other organizations. So we work very closely with Genesis. So we help a lot with their protective orders, a lot of their custody cases, divorce cases. We help Latino community here in town through Los Amigos. We also help some of the Meridian and Centerstone clients. So we really kind of work with other organizations as well. So to some extent, there's cross referrals and cross pollinating in that regard. So.
Yes. Tell me, you mentioned your board. Tell me a little bit about how the organization is governed.
Yes, we have an executive committee, which consists of John Maley, whose father basically started this organization many, many years ago, Bob Maley. We have Don Hawk from U.S. Bank, he's our treasurer, and A.J. Sickman is our vice president. So they're the executive committee. They kind of handle the day-to-day things that I need assistance with. And then we have our board of directors that include attorneys and non-attorneys from literally all over the country, which is nice. These are folks that have some kind of connection with Richmond, and so they are on the board to assist with fundraising, attending events, that type of thing. And so that has been tremendous assistance in that regard.
That's excellent. How large is your board?
Let's see here. We are up to 18 members.
That's awesome. Great. So in our last few minutes, Shane, what if you could give me a typical, if there is such a thing, kind of a typical day for you? I was intrigued that you mentioned adoptions. That's one thing I didn't know that you could help with. So sometimes I think that your work maybe could be a little depressing with some of the things that you see. How many adoptions do you get to do in a year?
We normally help with somewhere between 8 to 10 adoptions. It kind of depends on our level of involvement. Sometimes folks just want to know the process. Right now we have, I believe we have 3 pending at the moment. They're step-parent adoptions, I believe, the 3 that we have right now, which is nice. You know, the parent has married someone else and the other biological parent simply is not involved in the child's life. And so it's a nice way to bring some type of closure and permanency for that child.
Yeah. I have a blended family, so that type of thing is very important to me as well. So in our last few minutes, Shane, what would you like folks to know about Whitewater Valley Pro Bono that we haven't covered already?
We really are the only local provider of free legal services. No one else in this area does what we do. There is a part-time office down in Lawrenceburg, and I'm sure they do what they can, but they have to cover, I think, 7 counties. We also have Indiana Legal Services over in Indianapolis, but they cover the entire state. Neighborhood Christian Legal Clinic, also in Indianapolis, covers the entire state. But these folks are over in Indianapolis or in Lawrenceburg. We are the only ones here in town that does what we do. No one else does what we do. And so I think it's very important that folks know that we are here and that we can help, that they don't have to go through the civil court processes by themselves. They don't have to go to protective order hearing against their abuser by themselves. They don't have to confront their landlord by themselves. They don't have to try to get their children away from an abusive parent by themselves. That's the kind of stuff that we can and that we do help with on a daily basis.
And also, I can't reiterate enough that your services are provided for free and you need the community support. We'll have the information on the screen as to how they can get in touch with your office. But I would encourage folks out there, even if you've never needed these services before, if you've got a little extra income, think about this organization for a donation now and maybe around the holidays when most people think about giving. This is an organization that's making a difference in our community. Especially touches my heart when we talk about children in abusive situations and adoptions. You know, kids are very near and dear to my heart. So think about supporting this organization. And again, Shane, I want to thank you for what you do. I know that you could be practicing and probably making a lot more money, but that you have a heart for this and a passion for this. So thank you so much for that.
I'm happy to do it, Rachel. And thank you for having us, sir, here today.
And we'll be right back with more of the third sector. Welcome back. My next guest is Emily Leas with Meridian Health Services. Welcome, Emily.
Hi, thanks for having me.
Oh, it's my pleasure. Emily is the Regional Outreach Coordinator for Meridian, working out of Portland, I believe. But she is here today to give us some information about some programs that Meridian provides here in our Richmond area. If we could, Emily, start with a little overview of Meridian. What is it that Meridian does? Because I think sometimes we're confused about what it is Meridian, the services that Meridian provides.
So Meridian Health Services is a progressive healthcare organization that believes in treating the whole person. So not only do we have the physical health, but we also have behavioral health and social health. So like that whole person to get a whole spectrum so we can optimize, you know, that whole person's well-being. So we have primary care, which, you know, our normal, you know, your normal primary care offices that you would go to a primary care physician. We have dental care. We have our behavioral health services. And then we also have our addictions and outpatient treatment centers as well.
And I think most people know you for that addiction services. I honestly didn't know you had dental services. So that's a new piece of information for me.
Yes, that's actually new. We have that new service is going to be at our new office on South Street there in Richmond.
Let's jump into the programming that we want to talk about today. And I'm just going to turn it over to you and tell us what's going on here in Richmond that people need to know about.
So there's a lot going on in Richmond. I guess you kind of tell me where we should start, but we have several primary programs. So for our behavioral health, a lot of people think we have like 3 major programs. So we have our Connections program, which is a specialized program for those that have an intellectual or developmental disability. That program ranges from, we have patients, you know, young as 5 sometimes. We have some that are clear to their 80s. So it's a lifespan program. All of our staff in that program are specialized and certified to treat that population. And in there we have our counseling or therapy services, as well as our case management and the skills training services. So all of our services can be done either in the school setting, in the home setting, or in the community setting. So we do have that service available. We also have our children's services program. So we do have a partnership with the schools to where we can go in and provide services in the schools with the kids. We also provide that home and community-based piece as well, because obviously we don't want to just treat the child. We like to get the whole family involved and do family sessions because we know that that's where the change occurs, is in that family setting. And we have our adult services program, and that is again, the case management and therapy are also offered in that program. We do a lot of like independent living skills in that program, medication management, social skills piece. We do a lot of budgeting, money management, those types of things. And then, like I said, we are going to be offering the dental at the South Street location, as well as primary care. And then we also have our Foster Hope program. We don't have a go live date, but we are going to be starting our maternal treatment program there in Richmond. So if you're not familiar with that, MTP for short, maternal treatment program, but it's a partnership with Reed Hospital. And that is a program where we provide support services to drug addicted mothers and their unborn children. So we like to get them connected with services, obviously, while they are pregnant.
It's a shame that we have to have a program like that, but I know in this day and age, it's vital that we have something like that in place, because we do have drugs are prevalent in our community. So thank you for stepping up and working with Reed to provide that program for our mothers and the very youngest in our community.
Yeah, we're really excited about that. And then with that, we also have our addiction and recovery center in Richmond as well. So that is a detox and residential care facility as well. So the detox portion is usually like a 3 to 5 day, but the long duration of the service is usually about 30 days. But we provide them with ongoing support as well. And after they are discharged from that service, getting them connected with a therapist for ongoing care and a doctor primary care ongoing after they are released.
So this is a residential facility here in Richmond.
The Addictions Recovery Center, yes, that we currently have. It's a 15 male, 15 female bed unit, and that's open to anyone in the area that's needing it. So they don't have to be, from the Richmond area. We here actually in Jay County, we've referred our patients there to that facility before as well. And then obviously when they're discharged, they go back home in the community, and then we're hooked up to, whatever provider is closest to them for ongoing services.
There's a lot going on at Meridian.
Yes. Like I said, I could talk all day about it if you wanted to get more specific. So
a lot more than I realized.
Yes.
Tell us more about the Connections program. That was also a new program I heard you mention. What does that entail? And is that a new program, or am I just catching on all of a sudden?
So our Connections program has been around for a long time. It's actually, we're one of just a handful of programs throughout the nation, actually, that are accredited to serve this population and the dually diagnosed. So we're really excited about that. And that's kind of one of our founding programs at Meridian is our Connections program, because that piece really got our, what we call our behavioral clinicians, the ones that are always out and about in the community. It really is foundation from that program. So no, we've had it for a long time. But like I said, it's for children or adults. Here in Jay County, we have a partnership with, it's called JRDS, Jay County, Randolph County Developmental Services. So we go in to their workshops and provide services to their clients there. We go into their group homes, and we can work in group homes with the patients or in their own personally homes or out in the community setting. So we do things like that, or if you're familiar with Carry Services up in the Blackford and Grant County area, that's a similar thing that we do there. But yeah, it's just providing that that specialized treatment to those. Sometimes communication is a barrier for those patients. So all of our staff have experience and training as far, as communicating, working with the families, doing that case management piece. So anything on behalf of the patient, making sure that, all of the treatment team members are all working on the same page. We do a lot of advocating for those patients. And then that skills training piece. So whether that's daily living skills, coping skills, social skills, trying to manage their medication, whatever that may be.
So we've really pretty much debunked the myth that Meridian Health Services is just there for addictions. I mean,
right. Yes, we do a lot of different things.
What a huge scope of services you're providing in our community. I wanted to ask, how is the COVID-19 virus affecting your ability to perform your services? It has to be hard.
Yes, it definitely has been challenging. Lots of kind of quick movement on the ground. But back prior to March, we were doing teletherapy, some teleservices for telehealth already. So we were providing like telepsychiatry. So our psychiatrists were seeing patients for medication evaluations or medication management already via telehealth. Primarily, a lot of our services are still via telehealth. So they have the option. All of our offices are open with normal business hours, but patients do have the option to do either a virtual visit or an in-person visit.
Another area that you touched on were the children in our community. Mm-hmm. Tell us a little bit about some of the services that you provide for the children.
So in our children's services, we work with a wide variety of children and that have different diagnoses or, different histories going on. That can be, whether they've had trauma in the family, trauma, neglect, or abuse, whether they have like ADHD, depression, anxiety, oppositional defiant disorder, all of those different things. Those are just some off the top of my head, but we work with the whole family unit. We try to do family sessions as well as individual with the patient. But that's, like, again, helping them with social skills, coping skills. Maybe they're having trouble focusing at school. Some of the schools allow us to be in the classroom. Sometimes we'll pull them out of class to work with the students. And then again, that after school piece as well. So whether it's like family relational things going on, we do a lot of parenting skills, try to help the parents know how to, help best support their child, those types of things. So we do a wide variety of different things in that program.
What is it important for people to know about Meridian that we haven't covered already?
Well, I think I've pretty much touched on most of our services. But I did just want to kind of let people know how to become a patient. And so with COVID, we do some of our initial like pre-screening things for intake via the phone or a telehealth session. But I don't know, do you want me to share the phone number that they can call?
That'd be super.
Okay. It's 866-306-2647. So you can call that number, and that is a call center number. So you can call that number from anywhere in Indiana, and you can reach any of our offices. So you can just ask for which county or which location you're wanting, and you can be set up for an appointment. You can also schedule from our website, which is meridianhs.org, and you can actually schedule a virtual or an in-person visit via the website as well.
Thank you for that 800 number. I've learned a lot about Meridian that I didn't know today, and thank you for letting us know that dental health service is also coming. It sounds like you're really working toward being a one-stop shop for people that yes. have all types of health needs in our community. So
yes, definitely. And our dental and primary care are going to be coming to our South Street location. So we have different locations in Richmond. We have our Chester Boulevard, which is our children's services and our primary care. And then the South Street right now is our adult services and connections, and then the dental and primary care with the maternal treatment program hopefully coming soon. So
excellent. Well, thank you, Emily. It's been a pleasure talking with you today, and thank you so much for being our guest.
No problem. Thank you so much for having me.
And thank you for joining us today on The Third Sector.
This episode of The Third Sector is being made possible through the support of Dudas Law, providing skilled and efficient service for a wide range of legal needs. They can help guide you through a system that seems complex and scary. Dudas Law, skilled and compassionate attorneys serving you at 710 East Main in Richmond. And by RMD Patty Insurance, insuring Indiana families, individuals, and businesses since 1927. RMD Patty can help you with everything from life and health insurance to Medicare supplements and corporate wellness plans. If you love it, RMD Patty protects it. Find out more at rmdpatty.com.